Welcome to this week's Power Hour. The topic for this week is lifestyle medicine, and we are very excited about this topic and the guests that you're going to be hearing from and talking with today. This is actually our 20th Power Hour, and as you may recall, we started Power Hour as a way to keep conversing and keep collaborating, and above all, to keep building our community within healthcare in North Carolina. We do want you to know that we record this session, and you are able to listen to the recording next midweek is usually when we have it up on our landing site for KNF Institute for Physician Leadership. We do invite you to stay muted, but we also do want you to engage with our guests today. So please feel free to unmute and pose a question or use the chat function, and we will get to that as the conversations flows. But thank you for being here with us today. And again, Power Hour is coming to you from KNF Institute for Physician Leadership, offered by North Carolina Medical Society. And I'm going to hand it over to Franklin Walker, who is, as always, our eminent moderator for these sessions. Thank you.
Thank you. Thank you, Tina. Welcome, everybody, and welcome to our panelists today. We're going to be exploring lifestyle medicine, and we're very excited. As I was talking to our panel right before we came on, this really is starting to align really well with some of the programs that we have at the North Carolina Medical Society and the Foundation, and also with some of our guiding principles. But before we get into the discussion, I'd like to go around and give everyone on the panel an opportunity to introduce themselves, provide a little background, and talk about where you are currently working. So, Bonnie, Dr. Coyle, can I start with you, please?
Sure. Hi, everyone. My name is Bonnie Coyle. I am a board-certified preventive medicine and lifestyle medicine physician, and I am currently working at the Cabarrus Health Alliance, which is the public health department for Cabarrus County. And I've only been here about 6 months. I started right around when the COVID pandemic was starting to affect our communities. Before that, I spent 20 years in Pennsylvania working for a health system, running the community health and preventive medicine department there, where I was a lot of my work focused on lifestyle medicine type interventions.
Thank you. Dr. Andrew Nance.
Thanks for having me.
Yes,
My name is Andrew Nance. I'm a family medicine physician with Atrium Health. I work in Cabarrus County. I'm originally from Clinton, which is in Sampson County, North Carolina. I'm board certified in lifestyle medicine, and I also serve as physician lead of Cabarrus County Population Health.
Super, thank you. Mark Allison, how about you, sir?
Good afternoon. My name is Mark Allison. I'm the Executive Chef of Culinary Innovation for the Cabarrus Health Alliance. I teach the general population how to cook healthy. I'm originally from England. My disclaimer, I am not a doctor, I'm not a scientist or a nutritionist. I am a chef. I used to be the Dean of Culinary Arts for Johnson Wales University, and I was the Director of Culinary Nutrition at the Dole Food Company.
Super. That's really interesting. We can have a whole nother power hour just talking to you. Dr. Stephen Robinson, how about you, sir?
Hi, I'm Stephen Robinson. I'm a clinical cardiologist in the Duke Health System in Raleigh, North Carolina. I got interested in lifestyle medicine in a medical director for cardiac rehab, and happened to go to a lifestyle medicine conference and was shocked that I was not taught these things in medical school, but once I got over the shock, I started to dive in. So it's very important, these lifestyle skills.
Super. Thank you, sir. I think it would be important for us to level set with our listeners today. So I really want us to get a definition of what is lifestyle medicine and why is it gaining relevance today. So Bonnie, let me start back with you, please.
Sure. So lifestyle medicine is a field of medicine that uses evidence-based approaches that focuses on preventing, treating, and in many cases can even reverse diseases by helping patients and entire communities really, to replace unhealthy behaviors with more positive behaviors. And so when we're in lifestyle medicine, we focus on sort of 6 main behaviors. We call them the pillars of lifestyle medicine. And those behaviors are eating healthfully, which for lifestyle medicine practitioners means focusing on eating a predominantly whole food, plant-based diet. Being physically active, at least 30 minutes a day, 5 days a week, managing stress in productive ways, avoiding risky substance use such as smoking, drugs, alcohol use, getting adequate sleep, which many Americans just don't do, of 7 to 8 hours a night, and then having a strong social support system, social connections. The relevance of lifestyle medicine, when you look at America, we spend, I think our bill is like 3.6 trillion last year on healthcare. We're the most expensive healthcare system in the entire world. But then if you look at our health outcomes, many other countries are doing much better than us at improving health. They have longer life expectancy, they have lower infant mortality rates, they have lower chronic disease rates. And so even though we're spending a lot, we're not necessarily improving health. 6 in 10 Americans have at least one chronic disease, and chronic diseases consume 80% of the cost of healthcare. So if we could get chronic diseases under control, we could markedly reduce the amount of money we spend on healthcare. There's an interesting study that was done about 10 years ago that showed if people followed just 4 behaviors, if they did all 4 behaviors, that we would reduce 80% of the chronic disease that we're facing in our country and across the world. And those 4 behaviors are eating lots of fruits and vegetables, maintaining a normal weight, being physically active, and not smoking. 80%, we could reduce 80% of chronic diseases with those 4 behaviors. Now, the sad thing is, for Americans, only 3% of Americans do all 4 of those behaviors. And so we have so much room for improvement and could really make a much healthier healthcare system if we found ways to start encouraging more individuals to adopt those healthy lifestyles, which will attack those chronic diseases that are killing Americans: heart disease, cancer, stroke, diabetes, Alzheimer's disease. Those are all the top killers. They're costing a lot of money to take care of, and giving us poor outcomes. So by focusing on lifestyle medicine, especially with value-based care coming into our worlds, lifestyle medicine is the way to do well on value-based metrics, and most importantly, just make Americans healthy again.
Super. Dr. Nance, would you like to add on to anything Bonnie said?
Well, I'll just say that lifestyle medicine for me has been a game changer. I've probably used more of the tools and the teachings that I've gained from lifestyle medicine as compared to even my medical training, which I understand is a big statement, but this really is a game changer. And that's why I'm super excited and passionate about this work.
Yeah.
Super. Dr. Robinson, would you like to add?
Yeah, I agree with what they both said. And I try to frame it up as we've got lots of data and scientific studies, that kind of stuff, and we can prove these things work. A lot of it just bringing it to awareness of patients and saying, hey, try it. Just try it. You don't know what you get till you try it.
Super. And of course, Mark, I have to come back to you because your view of this might be a little bit different than the clinicians. So please add.
I've been very lucky in the fact that I've loved food and good food my entire life. So this has been more natural for me than most people, because most people don't cook. But I do think it's a way of life. And I think if you start eating healthy, you start reducing stress, you don't smoke, you get active and get out into the community, it can greatly improve your life. And I'm all about prevention. I think if we can prevent disease right from the beginning, then we're going to live longer, we're going to live happier, and we're going to enjoy life more. So to me, this is the best lifestyle you could possibly follow.
Super. Thank you, sir. a lot of our listeners are, friends or members or know about the medical society, and we have members that are physicians and PAs, and we do a lot of business in the healthcare environment, and they understand what a physician goes through in training, your medical school, your residency, maybe a fellowship. And so I'd really be interested, and I think maybe our listeners would be, in what additional certification and training you guys on the clinical side go through to become lifestyle certified. So Andrew, I want to start that with you, please, sir.
Absolutely. So I became certified as a lifestyle medicine physician in 2019. And I will say that there are multiple pathways to become certified, even if you're not a physician. So, but I will say that the path for me has been, after I graduated residency, I then was eligible to go on to take the whole process with this lifestyle medicine that I'll tell you now. So really it amounts to 30 hours of online CME. And that can be done through the lifestyle medicine, the American College of Lifestyle Medicine. They have multiple choices for you to decide how to spend those 30 hours. And then that also includes 10 hours, separate, if I may say, actually 10 hours of in-person CME, which you could get whenever you do like an in-person conference. And then there's a one case study, and that case study I did on a patient who has hypertension, and I followed him over 6 months by implementing some of these motivational interviewing techniques and reported his BMI changes, as well as reported the medications he was on, as well as reported a few other factors. And then finally, once you go through all of these checkboxes, the final piece is a 150 multiple choice question exam. This is an exam that takes about 4 hours, and it tests you on multiple things that you would have learned over those 40 hours of CME. And I actually pulled the themes within this exam that had the highest percentages of questions asked, just to sort of give our listeners an idea of the sorts of questions. So 26% of the exam is about nutrition science, assessment, and prescriptions. And by prescriptions, we're talking about lifestyle, health, nutrition prescriptions. 14% is physical activity science and prescriptions. So that would be something like, working with the patient to come up with a goal of saying, I'm going to walk, you're going to walk 2 laps around your neighborhood 3 days a week. That would be an example. And then the 10% is basically fundamentals of health behavior change, which in primary care really equivalates to motivational interviewing.
Okay, that's interesting. I want to dip into that a little bit more. Are you guys typically more inclined toward adult medicine, Andrew?
I would say that for me as a family medicine provider, I tend to think of it very family-centric.
Okay.
But I will say that there are probably multiple opportunities throughout the entire lifespan to really impact change for families and people.
Yeah.
Well, I would think with increasing childhood obesity these days, the pediatricians would want to get involved in this as well. So just a trend, I'm thinking there. Okay. I want to move on now and ask you each, what has lifestyle medicine meant to each of you personally, and how have you been able to help your patients and your family members? Bonnie, I want to come back to you, please.
Sure. So I got interested in lifestyle medicine actually at a really early age. I just didn't think of it or call it lifestyle medicine. But even in my early teens, I started noticing that my family members were very sick. They had a lot of chronic diseases, diabetes. They were dying of heart attacks at relatively young ages. And for some reason, in my early teens, I started recognizing that it had a lot to do with the behaviors. My family was largely overweight. Some of them smoked. They weren't exercising. And so I became very fascinated with the connection between the health of my family and their behaviors. And so went on and was studying that more and became a preventive medicine physician first, and then found lifestyle medicine, and have just been very passionate about it my whole life. I've really worked over the years with my own family members. not being overly pushy, just letting them see my behaviors and then hoping that would help them. And they all started coming and asking for help. And two of my relatives, I was able to help stay off of medicines that were in their 40s for high blood pressure. They were getting told by their doc they probably needed to go on meds, but by getting them to follow a plant-based diet and exercising more, they were able to avoid it. I had another relative who had a heart attack in his 50s. I was able to help him quit smoking, lose 50 pounds, and get prediabetes under control with lifestyle medicine counseling. I had another relative whose cholesterol was at almost 300. We got it all the way down to 200 in just a matter of months by switching to a more plant-based diet. And, those are the examples of my immediate family. And I can give just many more examples amongst the employees where I had worked and amongst our patients and community groups there. But I'll turn it over for some of the other folks to also share their stories.
Super. Okay. Dr. Robinson, please, sir.
So as I had mentioned, I got involved because I was the medical director for cardiac rehab at Duke Raleigh and went to a meeting. The impact it's had, the thing about lifestyle medicine, it touches all of us. Not only, people see, they don't listen to what you do say as much as they watch what you do. And so as you start doing these things, it just creeps around you, like your family, your staff. They know you're the person to ask about, how many beans do I need to eat a day or whatever sort of minutiae they get caught up in. And so that part has been a lot of fun to kind of be identified as the person that knows a little more about it and willing to kind of chip in. Family-wise, I think one of the best gifts I can give my children is healthy lifestyle. I mean, I can't think of anything more impactful than the knowledge of how to make food, what is considered good food, why is it important to get outside and get activities, loving connections, and those kind of things. I can't think of anything more important to pass on. And as they adopt those things, their friends ask questions, because when they come to our house, used to come to our house, they see what we serve and like, I've never tried these things before. But it hits at every level. The tip of our fork hits every level. Our personal health, our planetary health, the health of our loved ones. It just hits everything. There's so much power in the tip of the fork. The pandemic we're going through now has something to do with the way we get our food and what we do to this planet. So it's like you just pick a level that speaks to you and you can't go wrong. But that's what keeps me going for sure, is that it is so impactful.
Super. Mark, how about you?
I can speak from my own family, 5 members, and I've been a chef since I was 16, so I used to be a lot of fat, sugar, and salt in there to get that flavor. But in 1999, my middle son, Matthew, became a type 1 diabetic at the age of 14 months. We were actually living in Alaska at the time, and he is registered as the youngest diabetic in the state of Alaska. And when he became a diabetic, obviously that was concerning to the whole family. And we seen one registered dietitian for 1 hour. And that was the nutritional information we were given for a 14-month-old baby. So my whole approach changed to healthy eating then. And we started to eat a lot more whole foods, lots of fruits and vegetables, pulses, beans, and nuts. And Matthew is now 22. He is 5'9". He is currently 154 pounds, and his A1C is normally around about 6.5. And I'm very proud of him. And then my wife, unfortunately, she was diagnosed with stage 4 cancer in 2008, and she was given 3 years to live. So we basically moved my wife onto a plant-based diet. We brought in meditation, stress management, sorted out her sleep patterns, and she thrived without any treatment. Unfortunately, she passed away after 8 years of battling cancer. But when you consider she was given 3 years right at the beginning, to actually get to 8 years was phenomenal. And I put that down to the positive of her positive attitude and the fact that she was eating healthy and getting out and exercising. And personally for me, you know, being a chef and tasting food all day, I actually ballooned up to 205 pounds at one stage. My cholesterol was 226. My LDL was 145. And when we changed my wife to a plant-based diet, that's when I really changed my diet as well. And I'm currently 175. My total cholesterol is 149 and my LDL is 79. And I just had a recent calcium heart scan and it was 0. So if nothing else, I'm living proof that this actually works. So out of 5 members, unfortunately, my wife passed away, and I've got a type 1 diabetic, but my other 2 sons are extremely healthy. And just like the doctor just said, I think the best thing we can give our children is a good start in life. And I think it all revolves around health. And if we can give them that, then they can go on and achieve great success and happiness throughout their life.
Super. That's exciting news. Congratulations to you. And then finally, Andrew.
Absolutely. So personally, I didn't realize this. I mean, I was right on the cuff of being considered normal BMI versus overweight. My BMI was 25.1. And so for me, that equated about 178 pounds or so, which I was about a year and a half ago. And then once I adopted this plant-based whole food really lifestyle, I dropped to 165, which is where I've been in. So I'm smack dab in the normal BMI. My LDL actually went from about 115 to 78. So I'm very happy with that progress. And professionally, there's a long list I could talk about, but there were some things I noticed immediately once I started adopting more of a lifestyle medicine approach in my practice. One is that I had less consumer messages about side effects from medications. That I noticed very quickly. There were no extra calls to patients about trying a different medicine because that first medicine led to side effects. Another thing is I noticed that some of my patients who had been previously really challenging to control in their diabetes, I was actually not having to see them every 2 or 3 months like I had before. I also noticed that whenever I have new patients that came into the practice to sort of establish care and they had seen other providers and tried lots of different medications, that, and I know I'm thinking, wow, I don't know what else I could possibly start. I could really rely more on the lifestyle medicine, and patients really gravitate towards that. And I think one reason is that it's empowering for them. They see the progress, just like we talked about progress here that we've had. And I will tell you too, just another thing that I've made this a part of is like for a patient who comes in with, concerns about anxiety, that before I even talk about medications, I'm going through each of the pillars of lifestyle medicine and making sure that we come up with small goals that can help them. Because at the end of the day, medicines can help, but the real help comes from really helping empower patients and work through this framework that's provided through lifestyle medicine.
Super, super. As you guys have talked, and Bonnie laid out a little bit ago about the 6 pillars of lifestyle medicine, and then Mark reinforced something I was going to talk about, is it seems like that's good parenting advice, right? So you ought to tell your kids this is what you need to adopt to be healthy and old and stuff. But I'm interested, Andrew, and I'm going to ask everybody this question: what's the average age of your patients that are engaged in lifestyle medicine? And what percentage of your practice do you find focused on that? And I think it's going to be interesting to hear from your perspective. Bonnie's at the health department, Stephen's at Duke Raleigh. So again, there's a couple of things that I'd like for you to unpack, and starting with you, please, sir.
Sure. I'm happy to give that a shot. And so as a family medicine doctor, we see the whole lifespan in the clinic. I will say that the typical patient age range that really responds well to this, there's probably 2. One is between this 35 and 45 year range. For some reason, these are all just stories, from patients and experiences. They tend to really respond. They've noticed some changes with their body. They're not happy with things, and they're willing to sort of, change. The other is the patients who, believe it or not, have had hypertension and diabetes for quite some time, that probably are within that age group of 45 to 60. And I will say, too, I've been able to help work with patients who are 75 years old and help them lose 25 to 30 pounds through this process. I will say that I tend to still rely on the 5210 for my pediatric patients. And I think that if I have more time in clinic, I could really build more of a family-centric approach. But the challenge is really, on those pediatric visits to really sell the family members, because right now they don't, there's nothing wrong with the child or whatever that may be. And so I think that's part of the challenge. And I think if we went to more of a value-based care where we can really help educate the entire family during a clinic visit and have even more, ancillary resources to, continue with the teaching, I think that would make a difference. So to answer your question, I'd probably say the patients that respond best to this, at least in my experience, 45 to 55 years of age. And then there's a age about 35 to 40. And then for children, that's something that I think I'm going to have to continue to work on and explore more.
And just to follow up with that, Andrew, so every patient that you might see, and again, the pediatric patients, granted the family members, the moms, the dads are sometimes in the room with you, but since you've gotten certified in lifestyle medicine, do you find that now has overlaid everything that you're doing? So if I'm coming in for hypertension or something, you're looking at it now, not necessarily as a family doctor, but as a lifestyle doctor. Is that an accurate statement?
100%. And I'll have medical students rotate with me and they're like, what's going on? Like, wait a minute. Yeah. And, and then they're like, well, how do you even have that much time to talk about that within 20 minutes? But if you start off getting to know the patient, getting to understand who they are, where they come from, what's important to them, it really helps line up very nicely with lifestyle medicine. So absolutely, this is the filter that all of my patient care goes through.
That's awesome. Bonnie, I want to come to you. Same question.
Yeah, I have to echo what Andrew just said about that age group that seems to be most interested is that, the high 30s, 40s, because again, they've been practicing these unhealthy behaviors throughout their younger years, but kind of getting away with it, so to speak, in that their bodies weren't impacted yet. Now, all of a sudden, as they're getting a little bit older, their blood pressure's creeping up, their cholesterol is creeping up, they're being told by their docs they're diabetic, and that's when they're kind of a little more receptive and like, wait, I don't want to go on meds. I want to get healthy again. And so really seeing amongst the employees at my previous job and in the work that I do, that age group seems to be the most receptive because they're starting to feel the vulnerability of the behaviors that may not have been pushing them in the right direction towards health. But as a public health practitioner, I don't do much individual patient care, but we do more group programs and community efforts to make folks healthy. And we have to start early with lifestyle medicine because, as someone already mentioned, childhood obesity rates are getting worse. We're seeing younger and younger folks developing type 2 diabetes at ages that we just did not see back when I was first training years ago. And so the whole continuum is moving to younger and younger ages of more chronically ill folks. And, the projection now is that our children aren't going to live as healthy a life as their parents because of how much the food system doesn't support healthy behaviors in that. So I think it's really important, like Andrew mentioned, the 5210 program, that we are finding ways to work with families and especially children at a very young age. So we start to get those behaviors that will keep folks healthy kind of ingrained into their daily life. So it's important to start really young, but sometimes the people who are most receptive are more middle-aged because of the, again, vulnerabilities they're starting to feel.
Sure. And then finally, Stephen.
Yeah, so I'll echo some of the things they talked about already, and also too, Franklin, what you had mentioned about the framework. It changes the lens that you use because it's another tool that you can use besides just the prescription. But age-wise, I see 16 and above, and I don't really find as much correlation to age as I do to fear. Like when somebody has a bad diagnosis or just got a stent or something put in, and I think one of the best things that I found is helpful is to kind of get to what their thoughts and beliefs are around that, because that's what shapes what we do, is really what we think and what we believe. Because I've had people over 80 try this, and they cannot believe how much better they can feel.
Yeah.
I had a fellow that had a stent put into his LAD, and that week he went totally plant-based, started exercising, didn't think he was overweight, but he lost 30 pounds, and he sends me pictures from where he's traveling all over the place. Not so much now with COVID, but he was sending pictures, and the guy looked 10, 15 years younger. And so I think it's more about the receptivity of it. And I've had some people that have some, we get to see people at their best and worst, some really horrible things happen, and it's just they're not receptive to it. And, that's difficult for us as professionals to say, look, but you can't make them do it. And that's one of the things I learned in the Navy and in medical practice. You can't make people do things they don't want to do. And so you try to speak to maybe something that's important or is valuable to them, but in the end, you can't care about them more than they do because you just don't get anywhere. And so I think how can you speak or communicate to them? And when they're ready, you have to go to where they are because, like I said, you can't get people to do things they don't want to do. You can plant seeds, and maybe their family members can get on board, but everybody knows somebody who's trying to get their family member to quit smoking, and no matter how much you tell them, I think they push back just because you tell them to do it. But that's been my experience, and so I've really toned it down more to say, let's co-create a plan if you're interested or not. If you're not interested, then maybe next time. But I don't pull on that rope and play tug of war because it's just you end up not getting anywhere.
Right. Well, and I think some of the age brackets that were mentioned earlier by Andrew, the 35, 45, 45 to 60, and being a person who's now in that second category, there are going to be times that you have incidents, as that you mentioned, Stephen, with fear. And I would imagine fear can be a great motivator if you guys redirect it to say, now's the time to change your diet, get out there and walk and do all those great things. So let me ask you this. This will be a quick question, I think. How has the COVID-19 pandemic affected lifestyle medicine from a practitioner standpoint? And Bonnie, you and I had a conversation a couple of months ago when we first met, and you were talking about coming down to Pennsylvania, and of course things are a little bit different south of the Mason-Dixon line, of course. But tell us from your perspective as a public health provider how the pandemic has affected you in delivering lifestyle medicine.
The biggest change it's caused all of us in our work, I think, to really look at is how do we deliver really good care to patients in a more virtual environment. So we have been here at the Alliance, Mark can talk about this. He has been doing virtual cooking classes so that we didn't have to stop them, so that we can reach people and help them right now. We've been exploring telehealth and using virtual care as a way of continuing to provide folks the programs and education they need. We have a diabetes prevention program. We've taken that virtually. I think it's really important to emphasize that this COVID pandemic makes lifestyle medicine even that much more important, because we've really got two epidemics going on in the country right now. We have an epidemic of chronic disease, and that's actually what's fueling the response that we're seeing with the COVID pandemic being such a problem in our country compared to some other countries, that when people already have chronic diseases, they're much more likely to become infected and get very sick from COVID. So it becomes even more important that we're emphasizing to folks how critical lifestyle medicine measures are. So in our messaging and our ads on our social media sites at CHA, we're putting out there for people, like, remember, it's not just wash your hands, wear a mask, socially distance. It's also eat lots of fruits and vegetables, get out and walk, get enough sleep, manage your stress. And boy, managing stress is a really critical component right now, as everyone's struggling and dealing with the stress of loss of jobs, loss of the ability to come and go as they please, and the social isolation that comes with this. So I think it's really helped bring lifestyle medicine to the forefront as how important it is for us as a country to think about this.
Interesting. So Mark, since Bonnie mentioned, come to you next with that question, please, sir.
Yeah, I went from teaching live classes. We are actually in the wellness kitchen here. You can see that all the fruits and vegetables behind me painted on the wall, which normally we have around about 12 community members coming in to be taught how to cook healthy. So we went Facebook Live and we went YouTube, and sometimes we get up to 2,000 views. It's actually been working to our benefit, and we've got some live interactive cooking classes coming up in December that the majority of the population that have seen the Facebook Live have already registered for these classes. So actually the COVID has actually been a benefit to us, because more and more people have come to realize that they can come to the Cabarrus Health Alliance over their computer or telephone and take part in a cooking class. So for me, in general, it's been absolutely fantastic, because I've got more views, up to 2,000 at some stage. It'll be nice to get back in the kitchen and have people actually come in and they can actually taste the food. But our next series of cooking classes are going to be a follow along with Chef Allison class. So we are sending them out a shopping list 2 weeks prior to the cooking demonstration, and they can actually go out, buy all the food, bring it back home, then tune into my live cooking demonstration and follow along, and I'll make 3 or 4 different recipes that they can eat at the end of the session, but they'll learn techniques of how to prepare the food, how to cook the food, and how to choose the food. So for me personally, COVID has actually worked in my favor to get a bigger viewing from the general public. So for me, it's been great. It hasn't stopped what we're doing. We are still getting people tuning in to learn how to eat healthy. And I think for me, that's when it comes down to, you've got to decide what you want to choose to eat. But it's about education. If you don't know what to choose and you don't know how to cook, then somebody needs to educate you. So with being at the Cabarrus Health Alliance, it's worked really well for us.
I think that's a marvelous story. That's just awesome. Andrew, can you give us your views on how this has affected your practice?
Absolutely. I think the expansion for reimbursement to include phone visits has been crucial.
Yeah.
As Dr. Robinson mentioned earlier, a lot of this is about motivational interviewing and meeting patients where they are in their stage of change. And I think having consistent touch points with patients, either through like a electronic medical record, consumer message exchange, or through a telephone visit, we've really been able to touch base about every 2 weeks, at least really briefly, to say, hey, how are you doing? How are you doing on the goals that we set? Oh, okay, that didn't go so well. What'd you learn from that? What do you think is a good goal for you next? And then really helping them create a skill set is something that I've seen sort of come to fruition over some small exchanges. And then once they have the basics, they know that I'm always going to talk about vegetables, fruits, whole grains, nuts, seeds, increasing your daily activity, working on your stress management. They've heard the spiel. They start applying it to different things in their life. And the next time I talk to them, 3 months later, I see that they've lost the 20 pounds and their A1C is now controlled and they're not having to spend as much money on the insulin because we've gotten off of that. So for me, the phone visits has been crucial for lifestyle medicine.
Super, super. So I think I sent you guys some information prior to our talk today about one of the Medical Society's Foundation's program, our Community Health Initiative, which was designed to address the social determinants of health, chronic disease, and diabetes prevention. And through our partnership with the AMA and the YMCAs in North Carolina, we've been able to create a program for physicians to refer patients over the YMCAs for diabetes prevention. We've started a whole program where we actually have a website where we are recruiting physicians to sign that they're in support of diabetes prevention, because we have over 2 million North Carolinians that are pre-diabetic. I'm probably not telling you guys anything you don't know. And we're really excited about this thing. But tell me how you guys, when you assess folks, and you talked about, I think Bonnie said something about how do you refer patients to a Y, or how do you prescribe going to a Y? How do you prescribe lifestyle changes? Bonnie, can you talk a little bit about that?
Yes, I will. If I can just first make a comment about your OCHI program, because I
Sure.
think that is so right on track for what we have to do differently in marrying healthcare to public health and social services. Because again, healthcare only impacts a small component of the amount of premature morbidity and mortality we have in this country. It's really largely morbidity and mortality are largely driven by social determinants of health and lifestyle behaviors. And so by having programs like you've developed, where you directly connect for docs to make easy referrals to these programs, that's powerful. And so that's some of the work I was doing up at my old job, was baking right into Epic, which was our electronic health record system, automatic referral. So if somebody was asked, are you a smoker? And they said yes, the doc would be prompt to refer them to our smoking cessation program. If they had a hemoglobin A1C that was in the pre-diabetic range, they would be automatically prompted, would you like to refer your patient to the diabetes prevention program? And so the easier we can make the connection of physicians to those programs in the community, the better. There are programs like Aunt Bertha and more programs out there trying to help connect social programs, social service programs with healthcare providers. And that really has to be how we rethink the delivery of medical care, to link folks up with those programs that will really help them.
Super. I also want to mention that the Medical Society also runs a health plan with our partners Curie, that a lot of the medical practices that are our members actually have this as their health insurance for their doctors and their employees. And they're doing a well care program, and they're working on nutrition. So it's just another avenue that we're trying to kind of adopt what you guys are doing. So hopefully we're meeting in the middle on this thing a little bit. I want to get back to this diet stuff a little bit. And you guys have all said that you believe that you need to do a whole food, plant-based diet lifestyle. And there's also something that I did some reading about intermittent fasting, okay? Which sounds interesting. I'm not there quite yet. I like to eat every day. So I want to ask two questions, and I'm going to start with Mark first. One, how long does it take when you adopt this plant-based diet to see some results? And tell me about the benefits of intermittent fasting, please.
Right, then I'll answer one of them. I've got to be honest, the intermittent fasting, unless somebody can come up with some really good research, to me it just sounds like another fad diet. You know, I really believe that if you just eat whole foods, predominantly fruits and vegetables, and lean nuts and seeds and whole grains, then I think you can see the benefit within 7 days. I really believe that you will notice a change in your energy level. Your mind will not be as cloudy as it normally is. And I think it's just baby steps. You know, when I normally talk to people in my class, I normally tell them, you know what, if you just look at the 3 meals you're going to have during the day, and you take your plate and half of that plate is fresh fruits and vegetables, then that's a great start. You don't really have to change anything else diet-wise, because you'll be getting the nutrition that your body needs. If you can gradually change to a healthier breakfast, and then everything you're having for breakfast fits into a plant-based diet, then that is absolutely superb. Then look at lunch. And if you can do the same again, then look at dinner. It's baby steps along the way, because people know what they like to eat. So if you're trying to change them to a healthier diet, it's not going to work if it's forced on them. If they decide, I want to try and eat healthier, and then just take baby steps to eating more fruits and vegetables to begin with, then I think you will notice a difference within the first week. As far as intermittent fasting is concerned, I think your body has a tendency to know exactly how much food it needs to eat on a regular basis. And if you're eating nutrient-dense food, you actually eat less food, and it's more beneficial for your digestive system. So the fact that intermittent fasting might just be 6 hours of the day, I think people in general are still going to eat the same amount of food in that 6 hours as what they would normally eat in a 16-hour normal day. But I think changing to a more plant-based diet and a more healthy lifestyle that you include stress reduction and sleep patterns and exercise, not taking drugs, then I think your whole body is going to improve. Literally in 1 week, you will notice a change.
Wow, that's pretty swift. Bonnie, do you want to talk about the fasting thing? I'm very interested in that.
Yeah, Stephen and I were talking about intermittent fasting yesterday because we both have, our opinions. So let's have Steve voice.
Okay.
He has a lot of good ideas there.
So I want to echo what Mark said. I think it is having a plan about what you're going to eat and have a more mindfulness about it and say, this is important instead of just mindlessness. And I find people get very defensive if you ask them about what they eat because it's almost like religion. But to at least bring it up into an awareness of, hey, I have never questioned what I eat. What if I started questioning it and making a plan? And so, Mark, that's like bashing it together and actually have a plan, because then you're not just shoving something down. But about the intermittent fasting, there's some great data that's coming out about biochemically what goes on. And a lot of the places, I don't know if you've heard of the True North out west, that's where they concentrate on using fasting to jumpstart people into a healthier lifestyle. I don't use the word intermittent fasting. I use it more kind of scheduled eating, because people hear fasting, they feel pain. And so, being mindful of how much hours a day you spend eating. Also, the other way that I use it is to get people to get in touch with what is hunger, is because we confuse a lot of other signals for hunger. One of them, I use the 3 T's. You'll confuse hunger with tension. So if you're upset or stressed, you'll confuse that with hunger. With tired, that's another one. When you're tired, you'll start eating because you're tired, you'll get confused. And thirst. Those are kind of the 3 T's. And so I'll get people to get a little bit more in touch with what they're feeling by saying, okay, you're hungry. Go through the 3 T's. Wait 15 minutes. See if you're still hungry, because you may be confusing it for something else. But certainly as a big foundation of that is what Mark said, making sure that you're planning your meals and getting the good stuff in. Because once you get the good stuff, the other stuff will fall away, because you just can't eat it anymore. Like I grew up in the South, we fry our vegetables. And so after a while, you go, why did I used to do that? Because you get that body knowledge. Once you get the body knowledge of what is good food, I should feel good after I eat, not like some sort of lumbering dinosaur that needs to lay down. And so once you get that knowledge, it's like gold. Like when patients come in and say, I'm just soaring because I feel good when I eat well, I feel well. And so it's just so important to listen to your body, and it will tell us stuff. And I just wanted to say one other thing too about with COVID. It's another great reason to make your soil better, because our immune systems, our cardiovascular systems, they all depend on these same things. It's all one sort of unifying principle. And then with that program that you're running, if you can get it to a click on Epic, I hope you're scalable, because you get it down to, I can just type in, you'll get more things, but it has to be, now everything goes through Epic or your medical record. If you get it, like with smoking cessation now, if you can get those other programs going through Epic, it is way more effective.
Yeah.
Well, that's great advice. I'll tell you, we are working with a lot of people in the state, and as I said, the AMA has been a great partner, in the YMCA, but we've had some Duke physicians in the last month start using out of Epic, referring patients to the diabetes prevention programs here in Y of the Triangle in their 18 locations. And, they're back doing a few in-person classes and also virtual. But the Duke folks are very excited about the aspect that we figured out exactly what you're talking about. So we'll follow up with you soon, and we'll figure out how we can help you do that, because we really want to pump that up.
If possible, could I also add on a little bit more? Oh, I'm sorry, I didn't mean to interrupt you, Dr. Robinson.
Well, I just want to say, in Great Britain, Mark, you may know that they have started what's called the Ministry of Social Prescribing. And so that is, it takes it out of the physician's office like we can raise an awareness about it, but the actual nuts and bolts goes to a whole different ministry. And
Yeah.
from what I understand, it's been great because a lot of things that we think we have to do in a doctor's office doesn't necessarily need to be done there. And frankly, we're not good at it.
Yeah.
Right.
We be talking about, so it's like we're not good at it. We think we're good at a lot of stuff. That's why, doctors make poor investors because we think we're good at one thing, we're good at something else. But it's not true. But those taking as much of it into the social environment, taking it away, the doctors say, hey, it's important, and that will help light the fire, but let somebody who's good at it do it.
Exactly.
Well, one thing too, I was hoping just to add, for my patients at least, one of the first changes they notice is that their gastrointestinal system flows much better. They notice that within a week, and that's usually a win for most everybody. The other thing too, especially for patients that are discharged from the hospital with new onset diabetes, A1C of like 12 or 13, everybody's telling them about insulin, and you're gonna, the patients feel like once they start that, they're going to be on it forever. But what I've noticed is huge transformations if patients will just take a pledge, just say, hey, just go plant-based whole food for 2 weeks out of your life and see what happens, and then reassess. And if patients have enough momentum and energy to do that, which most do, especially being discharged from the hospital with such a diagnosis, that on the other side in clinic, they are like actually given much more hope. And for me, I think that's a huge opportunity to build on. So I would, that was one thing. And then the other thing is really you'll get a better result by the more you put in. So the more that you try to live out lifestyle medicine, the better result on the end. So sometimes patients that come and see me in clinic and they're very frustrated because they're on max doses of medications for their blood pressure, and they are walking, 5 minutes a day, which is great, but that's an opportunity to build and really work with them to say, well, we need to intensify, your regimen, just like you would intensify a statin, just like you would intensify other things in their treatment plan.
Super. Well, I'm going to make a suggestion for the new administration, whoever comes in, that we have a new cabinet secretary for social prescribing. So that's my suggestion. Okay. So moving on, and you guys have kind of talked about this a little bit, but we did have some interest in what are the best practices for engaging conversations about lifestyle change programs. How do you motivate your patients? And I know we've hit on some of that, but I'm thinking about now a physician in an exam room going through your paces. I mean, you can't stay in there for an hour. You got to move through it. What do you guys find are the top 3 things that each of you uses tools to engage your patients, keep them interested, and get them motivated? So Andrew, right back at you, please, sir.
Sure, absolutely. So one thing that comes to mind is that I usually pull up a nutrition label of something that they feel like is healthy, that I know is actually going to have a lot of salt, like breads, for instance. A lot of breads and some of the animal products out there tend to be saturated with salt and cholesterol. So I bring that up just to kind of go through that, because what I've learned too is that, it's not like they ever learned in elementary school or high school about reading nutrition labels. So to them, that's actually a really great moment to bond with patients, because no one's ever really sat down and actually talked to them about the nutrition label. The other thing is that I created a 1-page handout that's a survey, and it has 2 questions. Actually, there's 6 questions, but the first 2 questions basically are, how much do you agree or believe this statement? And I say, for patients with diabetes, eating a plant-based diet will improve blood sugars and patients can come off of medication. So if they put a 10, that means absolutely they believe it. If they put a 1, they say no way. The average of the 45 patients that I sampled on this quality improvement exercise said 8.8, meaning that they definitely think this will make a difference. I asked that same question about blood pressure, though, and the responses were about 8.2, meaning that from 1 to 10, 10 being absolutely, the average was 8.2. And then right under it, I basically asked them, well, how many handfuls of fruit did you eat that day? How many handfuls of a vegetable did you eat yesterday? Or how many servings or a handful of a whole grain did you eat yesterday? And so what that does is it shows them that they put down 9 and 10 that, if I ate more plant-based whole food diet, that it would improve diabetes and hypertension. And then I sort of use that to contrast, well, you're only eating half a handful a day, if that. So that to me has been a tool that I've used to sort of engage their stage of change. And oftentimes they sit there and they think, never thought of it like that. And then we work together to build a treatment plan.
Bonnie, how about you?
In lifestyle medicine, one of the tools we learn is to focus on writing lifestyle prescriptions. So just like the social prescription that Stephen was talking about, work with the patient in a shared capacity, see what they're willing to work on. If they tell you, I will never give up my ice cream, I will never give up my pie, don't start by asking them to give up ice cream and pie. Start with what they think they can do, because self-efficacy is big. Focus on the thing they say, I could do that. Yeah, I could increase my walking from 5 to 10 minutes a day. You want bite-sized, doable, very clear goals for them. I'm going to increase from 1 fruit and veggie a day to 2, that sort of thing. So be very specific about what you want them to focus on. But I do want to, as a public health doc, emphasize that one of the big things we have to do in a more global sense is make the healthy choice the easy choice. Right now, the average person, as they're driving home, will pass all kinds of fast food restaurants, can go out to restaurants where they can get very, very processed food, very, very large cuts of meat, and that it's much harder to find that farmer's market, those SNAP benefits, the healthy fruits and veggies, the restaurants that are serving really healthy, wholesome, unprocessed foods. So that's the role that public health and medicine need to kind of get together on. I just share a quote that I love from Wendell Berry. He says, people are fed by the food industry, which pays no attention to health, and they're treated by the health industry, which pays no attention to food. We got to get the two working together more. We have to get our food system to be healthier, and we have to get our healthcare system to focus more on nutrition and the other pillars of lifestyle medicine.
Yeah. And then, Dr. Robinson, I do want to come back to you, and I understand that given your specialty, the level of engagement is different than maybe the primary care folks, but still I want to ask you.
No, I go after it. So my biggest thing is to, you mentioned 3 things. One of the most impactful things I can say is that it's possible. Yeah. And that it is possible. I've had people, not many doctors will tell you can reverse something. And we're not taught that in medical school, that you can reverse something or you can keep it from getting worse. We're taught things that here's more medicine, you just keep getting worse. We got procedures we do. But sometimes I truly believe kind of getting into the beliefs, what they believe about their health, what they believe that they can do, and then meet them where they are. And one of the ways I'll start that is to say, tell me about your self-care. I get a lot of blank stares with, what do you mean self-care? What is self-care? And so that's a good way to kind of go into, like, tell me what do you do for the day? And just go to what they're doing already and say, okay, I appreciate that. And here is the direction if you want to beat that up. But it has to be based on what they want to do and what their beliefs, because it is very difficult. And you plant a seed every way you can. You find some way to relate and plant a seed. And then I have a resource list and say, be very supportive. And I let them know that this stuff lights me up. And you send me a message about this story where you did this or that, and it just lights me up to say, look, just give me a one-liner. I did this and I feel it. Because that interaction, to me, it makes me feel good. But at the same time, I think they get something out of it also, just to let them know, hey, I'm here to support you. Make an appointment and we'll just talk about lifestyle. I won't talk a thing about anything else. We'll just talk about lifestyle. And the way it is in the health system, as a cardiologist, I can say, look, we talked about preventing heart disease, and I'll just bill it just like a visit. So I think we have to do it within our current system. We just need more agency within that system in order to get these things out. And there's different ways. That's what I love about lifestyle medicine when you're kind of with your people. There's so many different ways to approach this. And I was an engineer before I was a doctor, and I love turning knobs and saying, what if we try it this way? Let's tweak the system. And the systems are designed to get the output it gets. And so this outcome is because of the system we're in. And we can make small changes, and it makes a big difference. And sometimes I think, as patients, I don't think they're listening to me at all. And they come back and say, look what I did. And I'm like, what? And I'm like, woo!
That's
Because
awesome.
it is. It's very joyful, and I think we experience a lot of injury throughout the day because we see
Yeah.
people that we think we could probably help, and we have different tools, and that's why we went into medicine. But it's that getting it out there and being able to use it. And it's just slow. You have to be patient. You have to accept where people are and say, I'm here if you need me.
Super. Well, guys, we're at the top of the hour, and having done this thing, as Tina said, this is our 20th episode of the Power Hour. This time has flown by. You guys clearly are so passionate about what you're doing, and it's also clear to I think the listeners and myself that you're enjoying what you do because you're really making a difference. And what you're doing is so relevant now to the place we find ourselves in. And I can't thank you enough for this great discussion today. And with that, I'm going to give it back to Tina.
Thank you, Franklin. And I just want to thank everybody as well for being here today and for this conversation. I think it's such an important topic, and I thought this hour flew by, and I was thinking we need to talk about this more and more often. I also want to say to everybody who's listening that cooking plant-based is delicious. There's some really yummy recipes, and you can get desserts and chocolates and stuff. So don't think that cooking plant-based is boring. It's absolutely delicious. But having said that, thank you again so much to those of you who were our guests today, and thank you to those of you who were in the audience. As I said before, this is recorded, and you will be able to access the recording about next week. As always, this hour is to build conversation, build collaboration, and above all, build community. And we welcome you to come back and check in with us again. The next Power Hour is going to be in 2 weeks, and the topic is going to be posted on the website as well within the next week. Thank you so much to everybody, and I hope you go home and cook some plant-based delicious recipes now.